How is endometriosis tissue identified microscopically? Imagine trying to find tiny clues that reveal the presence of endometriosis inside the body. When doctors suspect endometriosis, they often perform surgery, usually a laparoscopy, to look inside the abdomen. During this procedure, they may take small tissue samples called biopsies from suspected lesions. But how do they confirm these tissues are truly endometriosis? That's where microscopic examination comes into play. Under the microscope, pathologists look for specific features that set endometriosis apart from other tissues. The key signs include the presence of endometrial glands, which are small, tube-like structures that normally line the inside of the uterus. In endometriosis, these glands are found outside the uterus, in places like the ovaries, pelvic lining, or other abdominal organs. Alongside the glands, they also look for endometrial stroma, which is the supportive connective tissue that surrounds the glands. This tissue is essential because it confirms the tissue is of endometrial origin, just located in an abnormal place. Another important microscopic feature is the presence of hemosiderin-laden macrophages. These are immune cells that have ingested iron deposits from old blood. Since endometriotic lesions often bleed cyclically, these macrophages contain iron pigment from the bleeding, which is a telltale sign of active or past bleeding within the lesion. The combination of at least two of these features outside the uterine cavity helps confirm the diagnosis of endometriosis. It's important to note that visual inspection during surgery can sometimes be misleading. Some lesions may look like endometriosis but lack these microscopic features, while microscopic examination can reveal endometrial tissue even in tissues that appear normal to the eye. Advanced techniques like immunohistochemistry can help identify specific cellular markers, providing additional confirmation, but the core diagnostic criteria remains the identification of glands and stroma outside the uterus. This microscopic confirmation is especially vital in cases related to fertility. Knowing the extent and location of endometrial tissue helps guide treatment options aimed at improving reproductive outcomes. Accurate diagnosis ensures that women receive appropriate care tailored to their specific condition. In summary, identifying endometriosis tissue under the microscope involves finding ectopic endometrial glands and supporting stroma, often accompanied by hemosiderin-laden macrophages from bleeding. This histological evidence is the gold standard for confirming endometriosis after surgical and clinical evaluation. Always consult a healthcare professional for personalized diagnosis and treatment options, as individual cases can vary widely.